Welcome to Part 3 of Mental Health in Life and Sport for SMD 210. The objectives for this last part of the Mental Health lecture series include learning about the following mental health disorders: anxiety disorders, stress disorders, and a few other mental health disorders that may affect athletes. Let's start with anxiety disorders. Anxiety disorders are characterized as a negative mood of apprehension accompanied with physiological characteristics. There are numerous different anxiety disorders. We will cover today general anxiety disorder, performance anxiety, panic attacks, phobia, social anxiety, and obsessive compulsive disorder. Everyone experiences some level of anxiety in their life. However, it's when that anxiety exceeds what might be normal for a situation, or the anxiety affects an individual's ability to function in their life, in sport, in their job, etc., is when that issue needs to be addressed. Anxiety is fear when there is no actual threat or harm to oneself. Anxiety can be focused on specific things, and that is known as phobias. But it can also be global or more broad-ranging anxiety, such as general anxiety disorder. But let's start first with looking at performance anxiety in athletes. Performance anxiety occurs when there's an overabundance of anxiety during or before performance or competition. An athlete's body will be in overdrive, in which they'll experience too much adrenaline. They cannot achieve their peak level of performance. Often, they cannot even start or begin their event. They'll make uncommon mistakes in their performance, and often they'll freeze up in specific performance situations. Performance anxiety doesn't just occur on the spot. It will build up leading up to competition. However, usually it will subside or completely diminish after competition. It usually does not affect an athlete's life outside of performance or their competition in their sport. However, if the anxiety translates into multiple life settings or significantly affects their ability to participate or compete, that's when it becomes a mental health concern. So how do we know if an individual is experiencing performance versus clinical anxiety? It will be determined based on the degree to which the fear is interfering with an individual's normal daily functioning. If you suspect that an individual or an athlete may be struggling with anxiety or is experiencing anxiety symptoms, the best step is to refer them to a mental health care professional. Clinical anxiety. Let's take a look at the physical signs and symptoms. Anxiety is very similar to what you would associate with fear. The experience of an increased heart rate, feeling that one's heart is pounding, shortened breaths, trembling or shaking, sweating, having cold hands or feet, dizziness, choking, muscle tightness, numbness, and headaches. An individual experiencing clinical levels of anxiety will have their mind flooded with thoughts of losing control, disaster, going crazy, or thoughts of death. Typically, after the situation resolves, an individual can recognize that their fears were not typically in line with the given situation. Despite this, and even though they might recognize this after the experience, they may not be able to control their fears the next time. Let's take a look specifically at generalized anxiety disorder. Individuals with GAD may be sometimes inappropriately referred to as worrywarts. They won't just be worrying over a few things, but experience haphazard worrying about almost everything. Typically, these individuals find themselves being unproductive in their life and having trouble enjoying their activities of daily living. Here's some experiences of individuals who struggle with generalized anxiety disorder. One quote states, "I'd have terrible sleeping problems. There were times I'd wake up wired in the middle of the night. I had trouble concentrating, even reading the newspaper or a novel. Sometimes I'd feel a little lightheaded, my heart would race or pound, and that would make me worry more. I was always imagining things were worse than they really were. When I got a stomach ache, I'd think it was an ulcer." The APA criterion for diagnosing generalized anxiety disorder is excessive anxiety and worry, or apprehensive expectation, occurring more days than not for 6 months about a number of events and activities. The individual will experience difficulty to control the worry, and these experiences must be associated with 3 or more of the following: restlessness, being easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep issues. Phobias. Phobias are types of clinical anxiety disorders in which an individual experiences intense fear triggered by a specific thing or situation. For example, the fear of heights or acrophobia, the fear of tight spaces or claustrophobia, or the fear of spiders, arachnophobia. These phobias can become extremely problematic for individuals when these triggers or the fears are found frequently within life, such as fear of water, dirt, germs, or people. Those with phobias work very hard to avoid any triggers. One specific type of phobia is known as social phobia, also known as social anxiety disorder. An individual experiencing social phobia has a fear of social or performance situations in which they believe they will be scrutinized or judged by others. This can include fear of simple interactions with other people. Social phobia can be a serious condition and can become even more complicated when avoidance leads to agoraphobia. Agoraphobia is anxiety about being in places or situations from which escape might be difficult or embarrassing, or in which help might not be available in the event of having a panic attack or panic-like symptoms. Therefore, an individual with agoraphobia may have fear of being outside the home alone, being in a crowd, being on a bridge, or traveling on a bus, train, or car. The situations are either avoided or else endured with considerable anxiety. Therefore, individuals with agoraphobia rely on being accompanied by others to attempt to enter these types of situations. Clearly, an individual suffering with agoraphobia leads an extremely different lifestyle. Panic attacks are very common with anxiety disorders. Panic attacks essentially are experiences of intense anxiety. These experiences occur when an individual cannot control their panic. They may feel as though they're in immediate, life-threatening danger when actually they are not. There are 3 subtypes of panic attacks: unexpected or uncued panic attacks, and this is an initial panic attack for an individual. Situationally predisposed, so when an individual anticipates a panic attack because they've already had a previous one in a similar situation. Or situationally bound or cued, so these panic attacks may occur when an individual is put into a specific situation, but not anywhere else. The APA criterion for diagnosing panic attacks includes a discrete period of intense fear or discomfort in which 4 or more of the following symptoms develop abruptly and reach a peak in 10 minutes. palpitations and racing heart, sweating, trembling or shaking, shortness of breath, chest pain or discomfort, choking, nausea or abdominal stress, fear of losing control or going crazy, fear of dying, numbness or tingling sensations, chills or hot flashes, feeling dizzy or faint, derealization or depersonalization, also known as detachment. The last anxiety disorder we will touch on is obsessive-compulsive disorder. Obsessive-compulsive disorder is characterized by obsessions and compulsions. Obsessions are persistent anxious thoughts that an individual experiences, and the compulsions are repeated actions in response to those obsessions. The obsessive thoughts are typically inappropriate for a given situation and cannot be stopped on their own no matter how hard the patient tries. Therefore, the process goes as such. An individual experiences an obsessive thought, so for an example, that their hands are covered in germs. They will then have compulsions in attempt to relieve the anxiety surrounding that obsessive thought. So the compulsion might be excessively washing their hands. The anxiety may be temporarily relieved after the compulsion occurs. However, the obsessive thought almost always returns, and the compulsion must be repeated to relieve the anxiety. Typically, these compulsions take significant time from an individual's normal life when they are experiencing clinical levels of obsessive-compulsive disorder, at least 1 hour or more per day. Obsessive-compulsive disorder is also known as OCD, but very often in our society, the term OCD is used very laxly. It is important to note that claiming that you are OCD or so OCD in a certain situation may be offensive to individuals seriously struggling with obsessive-compulsive disorder. Individuals with OCD might hide compulsions from others, even close family or friends. Common obsessions include being contaminated, doubts of security or accuracy, excessive need for order or organization, and aggressive sexual thoughts. Obsessive-compulsive disorder is anxiety and must be treated in order to be relieved of the obsessive thoughts. The most common anxiety disorders treatment include medications and therapy. Medications can be prescribed to stabilize the chemicals in an individual's brain that's causing the anxiety disorders to occur. Side effects are typically well tolerated. However, some anxiety medications are banned in sport at certain levels. Therefore, emphasis for treatment of anxiety disorders for athletes should be put on therapy. There are various different types of psychotherapy that can occur for mental health issues and in particular for anxiety disorders. One of the most common types of therapy is known as cognitive behavioral therapy. CBT directly addresses both feelings of fear and avoidant behaviors in individuals experiencing anxiety. Gradually, the individuals will be exposed to the object of fear, and the goal will be for individuals to learn appropriate behaviors within their life when experiencing these anxiety disorders. Let's move on to stress disorders. Stress disorders occur in response to extreme stress or trauma. So, for example, car accidents, sexual assault, war zones, or dangerous events. Stress disorders create fear-like symptoms about anything resembling their trauma. Individuals may be extremely jumpy or overly careful, have difficulty falling asleep, experience nightmares, difficulty concentrating, handling frustrations, and may have frequent thoughts about the trauma. Very often, individuals with stress disorders experience flashbacks or re-experiencing the trauma that they had previously experienced in their minds, and very often they may react accordingly. The two main types of stress disorders we will discuss is acute stress disorder and post-traumatic stress disorder. Acute stress disorder occurs immediately after a trauma and is typically considered normal, especially for an extreme trauma such as a war zone or experiencing or viewing a homicide. However, post-traumatic stress disorder, or PTSD, occurs if acute stress disorder is not resolved, and PTSD can last for the remainder of an individual's life, especially if left untreated. Individuals with stress disorders must be treated, or there's the major potential for it to not resolve in their future. PTSD is characterized by an individual experiencing a trauma event that is perceived as a major threat to one's life or self, or they have viewed a scene, such as a mass homicide, outside the realm of normal human experience. PTSD traumatic events are followed by re-experiencing the event, such as intrusive thoughts, nightmares, or flashbacks, having negative changes in mood or cognition, for example, memory problems, negative thoughts, feeling detached, experiencing avoidance, so avoiding thoughts or feelings connected to the event, or avoiding people and places connected to the event, and increased arousal, difficulty concentrating, being irritable, being easily startled, or having trouble with sleeping. And lastly, let's talk about adjustment disorder. Adjustment disorder is in its own category. Adjustment disorder is when an individual experiences signs and symptoms of mood disorders in response to difficult life experiences. For example, an individual going through loss of a loved one, moving, employment difficulties, relationship issues, serious illnesses, financial struggles, or unexpected change. The APA criteria for diagnosing adjustment disorder is the development of emotional or behavioral symptoms in response to an identifiable stressor that occurs within 2 months of the onset of the stressor. So evidence of either of the following must occur. Number 1, marked distress that is in excess of what would be expected from exposure to the stressor. So for example, if an individual experiences the loss of a loved one, it would be normal for them to experience the grieving process. But if their grieving or depression or behavioral symptoms lasts longer than normal or is in excess than what should be quote-unquote normal, and they're seriously suffering or struggling, they may be dealing with adjustment disorder. In addition, they may experience significant impairment in social or occupational or academic functioning. Lastly, symptoms should not persist more than 6 months after the stressor has terminated. So for an individual to be diagnosed with adjustment disorder, these signs and symptoms should be occurring in less than 6 months after the stressor initially occurred. If an individual continues to experience mood, emotional, behavioral types of symptoms for longer than 6 months, this could develop into major depressive disorder, generalized anxiety disorder, or other mental health issues. Very often, mental health care providers use adjustment disorder as a preliminary diagnosis to begin treatment. And as treatment or therapy is ongoing, they usually are able to uncover or delve into what the individual is actually experiencing and come up with a later diagnosis, very often depression or anxiety. Again, adjustment disorder can occur with either depressed mood, anxiety, or both. Specifically in athletes, adjustment disorder may occur post-injury, after being cut from a team, or after realizing they have no career in their sport. Treatment, again, as with most mental health conditions, includes therapy. And the goals of therapy will be to assist in managing these stressors and getting the person through their symptoms. Other mental health disorders we can consider. Attention Deficit Hyperactivity Disorder, or ADHD, is another very common mental health disorder in our society. ADHD is characterized by the inattention or hyperactivity of an individual, or the combination of both. Typically, individuals are diagnosed with ADHD in childhood. Some signs and symptoms include difficulty finishing things, often losing things, being forgetful, difficulty organizing tasks and activities, being easily distracted, nonstop talking, or touching or playing with everything. Athletes with ADHD may have trouble in slower-paced sports, such as baseball or softball or golf. Again, treatment for ADHD includes therapy and very often specific medications. Most medications for ADHD may be stimulants. However, it's important to consider that many stimulant medications are banned by the NCAA and other athletic organizations. Therefore, individuals involved and employed in sporting organizations should be aware of these regulations. Lastly, ADHD can be treated in addition with therapy and medication by using education and self-management strategies. Now that you have learned about various mental health issues, you may have become more aware of individuals in your life, such as friends, family, etc., who may have, in the past or currently, be struggling with mental health issues. On your ticket and worksheet, share your mental health experience, meaning you can share an experience or a story of a friend, a family member, yourself, or your reaction to learning about a mental health issue. It is 100% up to you how much you would like to share or disclose. But remember, everyone has in some way had some connection to experience with mental health issues. What's your connection? Write it on your ticket and worksheet, and we will discuss in class.